Dr. Hrishikesh Pai, thank you very much for joining us here at Femtech Next. Our focus is really to understand where is women's health headed. You and I have in the past interacted talking about menopause and many other issues that women face. Just want to kind of understand, where do you see the larger issue around women's health today?
No, so basically, na, in India, we have got a population of now 1.41 billion. We have actually crossed China just 2 weeks back, and we have become the largest country with the largest population in the world. And about, let's say, about 50% of that population is women. The ratio is about 1020 to 1000 uh, males, so it's nearly equal at present. And the healthcare is, I would divide it into two compartments: well-off compartment of 200 to 300 million people, and a not so well-off compartment of about 1.1 billion people. So both of them have different, problems which they face as far as women's health is concerned. But the overall, because there is a kind of gender inequity in our country, and but in the last 75 years we have been able to overcome it by doing a lot of affirmative action as far as women are concerned. But there's still a long way to go. So that
Yeah.
gender inequity comes in the way of effective implementation of women's health program in our
So,
country, both.
you reflect. You said 200 to 300 million women, particularly looking at, let's say, education as a critical factor in people making health choices. What do you think can really be the essence of that problem? The reason I'm asking you this is that we are a very disease oriented population. We'll spend lakhs and lakhs of rupees to solve a disease. We'll take a loan to solve a disease, but we won't spend those few thousand rupees to prevent it.
Yeah, because it's all connect. Though I don't agree about the education, but well, let's say that education is very important or integral part of women's equity in the future. And even now, I think, I don't know the exact figures, but there's quite a drastic difference between the level of education in men and women in our country. So that comes in the way of accessing healthcare as well, as far as women are concerned. uh, but even in the educated class, to give you an example of my own mother, we have five gynecologists in our family, but she never did a pap smear in her life. So even the educated class. So because the other day I was in Uttar Pradesh in a Government of India program, and our we are oriented. India is oriented towards curative medicine. It's somehow not oriented towards preventive medicine, and that it cuts across the classes. So even in a upper class, or a, let's say not class, let's say in a well-off class of people, they also don't access preventive care that much. It's of course the lower, the, let's say, not so well-off class doesn't have access anyway. They don't have the
Yeah.
ability to access it. But even the people who can, they are more focused on the curative part of medicine.
What is
So we
going to
have to
change
change that
this?
thing. We have to
What will
change that
change it,
prop.
Dr. Pai?
So, like, as the president of the federation, recently during the last month was the World Cancer Week. So, we have 266 societies, and total number of gynecologists are 39,500 in the 260. So about 68 societies participated in my Pratibandh program. It's called for cancer, cervical cancer program, where I covered them for not only the cancer cervix, but also I made them do a self breast examination and a abdominal examination as well. And 68 societies of federation participated in this program, and we had 4,300 people whom we examined, the women. And you will be surprised that majority of these women, so we had a pickup rate of 3%. They had breast, like some kind of breast finding, like a lump or something. And around 10% of these women, 4,200, had a positive visual examination of cervix finding, some abnormality on the cervix. So, and but the majority of these people had come for the first time. They had never been. So basically, the whole community is there sitting in the the whole country is sitting in the community. They don't come to the hospital. They come to the hospital when it is too late. So we don't really know what is the level of disease that is there in the population. We know Mota Mota National Family Health Survey is very good, but it gives you a general idea. It doesn't give you the internal idea. What is
Yeah.
the so similarly, I had done as a president. I did the national. So we had done around 1,80,000. We have done about 70,000 hemoglobin tests last month. We had a and so we are doing the analysis. But in my initial testing analysis, nearly 50% prevalence of anemia was there. So they don't come only. So we have to go to them.
Yeah.
So what is the next step? We have to the providing corporate hospitals, providing maternity home, providing government hospitals. They come to the last step. If we want to change the health of this country, we have to go after them. So we'll have to go to the community and pull them out and do their exam. That's the only way. There's no other way.
Got it. So let me just now get back a little bit into your core, expertise, and ask you. There was traditional wisdom in thinking that gynecology is one stream, mental health is another stream, endocrinology is another stream. But today, the more we realize, particularly having founded Gayatri, one of the things that one recognizes is that women need round the clock holistic care through multiple experts, and this is not something that can go without the other. I mean, I imagine nearly everything gynecology for me has come with nutrition or mental health counseling, and that has actually really helped me solve my gynecological problem in a much more holistic way. How do you think that approach is the right approach for the future?
Yeah, so this is the very right approach. You have to have a wellness clinic concept. So actually what happened is, and this is what I always am saying, that we went from being a general gynecologist who treating everything to a specialized. So last 3 decades have been specialized care, but now we are almost all of us. Many of the gynecologists are doing all things again. So it's a full circle, and we need to have a total care. So total women's care is the new concept. So where the preventive wellness is there, and in fact, as a president of FOGSI this year, my slogan, every year we have a FOGSI president slogan, and this year my slogan is Badlao, change, and I define it by integration, that is Ekikaran. Then the second word is Samanta, that is equity, and third word is Takniki, that is technology. So I feel that integration of care is very important, and I have made a new film, a cartoon, which tells you about the journey of a girl from beginning of birth till the menopause. And this 10-minute film I'm planning to distribute to all our 40,000 members, and they can play it in their waiting area. See, when the patient is sitting and waiting for the gynec, and she looks at the TV, and silently the TV is playing this whole journey of 10 minutes, then you're giving her the information. You're telling her there is a vaccine available. There are 8 vaccines that are available, which all the women should take throughout their life. So you are telling her through. You can't tell your secretary to tell when
Awareness
she's
is
waiting.
central, as you said. I want to kind of ask you that again. We are considered, a country which is perhaps the largest with the diabetes issue, continuously has an obesity problem, um, cardiovascular issues. We hardly talk about women. They've been left out of the research, but it's been huge impact and lots of data to show that perhaps more women in the world get heart attacks than men. All of these are so intrinsically linked. How do you think? What's your message to women about taking charge of their health? Perhaps starting at digital platforms, then going into, because there's sometimes hesitation, or maybe they want convenience and affordability. How do you think technology can help all of this?
So I personally feel one is that advocacy is very important from the government and the associations of doctors. So advocacy in the television media, in the digital space, and awareness building is very, very important all the time. I feel that government should spend 25, 30,000 crores on advocacy, and not only on the Doordarshan channel, but also on the Colors channel, also on the Sony TV channel, because that's where the 300 million are also seeing the program. So advocacy and awareness building is very important, and through that, I think a holistic kind of care where they can go once a year, do their pap smear and HPV test, do their breast examination, do an ultrasound if necessary, and just do a point of care. Now there are new techniques where you just prick and point of care, do their HbA1c to rule out diabetes, do their TSH to rule out a hypothyroid state, which many women have after the age of 40, do their vitamin D level and do their hemoglobin level. That's it. And you cover everything and then give them the vaccines, various vaccines throughout their, like starting from HPV vaccine, the rubella vaccine, and then the COVID vaccine if necessary at acute time, the influenza vaccine during pregnancy, and the shingles vaccine and the pneumococcal vaccine during the after the age of 50. So once you do this coverage of the entire vaccine system, give them the care of contraception, give them mental health. Mental health is very important, and ask them. This is the point when they go to the gynec, ask them whether they are having some violence in their life. Ask them whether they are being beaten by their by someone around them. So these are ask them whether they're being sexually harassed. See, the doctor's clinic, especially the gynecologist clinic, is one point when you can touch the patient, and that touch has to be holistic touch. It has to be 360-degree touch, and from that touch we need to get that information which will help us to treat them effectively.
What are the various transformations you expect digital technology and mobile phone to do for gynecology in the coming years?
So there's already a lot of AI transfer. I'm specialized in IVF, egg freezing. So already I'm using three artificial intelligence programs in my lab for grading oocytes prior to egg freezing, grading embryos prior to embryo transfer. So the already AI has come in a big way in the IVF lab. It's also coming in a big way in obstetrics, delivery care. There is now AI being built, the new AI system where you can predict whether she will go for a cesarean or a vaginal birth. So, because obstetrics is a very big thing in our country, and we do nearly 30 million deliveries a year, India does. And, one of the blames that is given for the against doctors, gynecologists, is that you do a lot of cesarean. So, we are trying to bring in a lot of technology and using technology to find out how we can reduce the uh, incidence of cesarean section rate and try to bring in more vaginal birth. So we can predict preterm birth also. So there
Yeah.
are a lot of things coming in on in a very big way. And I personally, even you will be surprised. We are now getting handheld ultrasound machine just on your mobile phone. You can in remote areas of the country where there is no access, we can point of care handled scanning. The ASHA worker can scan it, and we can transmit the images, and we can tell that this patient is in a danger and can be shifted to the district hospital or a central hospital. And there will be in the future drones. We can just send a drone to
Right.
pick up the woman and bring her. So because one of the big problem we have faced, especially in the northeast in our country, is the transportation problem. Transporting a patient who is in crisis to the main central is a big problem. But the drones are here in a big way, and I foresee drone
Yeah.
taxis ferrying patients to the district hospital. So there's a lot of exciting new things that are coming in the future, which will really transform not only our life, but medical care will be massively transformed
Yeah.
with
Just before I
technology.
let you go, Dr. Pai, one important question, and particularly here at Gayatri, we constantly are hearing from women that they're tired of being treated as baby bearers and always expected to sort of go to a hospital only when they're pregnant, and the first thyroid check happens, in their 30s because they discovered it during their pregnancy. What's your message for just women who don't necessarily want to think about pregnancy at all? How do they and why should they, keep up with their health? Because I think we have a conditioning in our country that women's health is maternity.
Yeah, but no longer true now. We are, and that will all change by awareness. So the awareness among the medical fraternity is also important. Changing our attitudes towards the patient is also very important. We are the healthcare providers, so we need to also change, and we are changing. And that's what I've been telling our members, that we need to now shift from curative medicine to preventive medicine, because overall the health of the population is improving. So we need to go into how to from trying to save mothers, we need to go towards trying to improve the mothers. And let's say I need to remove that mothers word from my mouth and say that women, because mothers denotes more of maternal mortality, women, obstetric, delivery. What you are saying, it's a cliched kind of topic, and but things are changing now, and they have to be empowered. They need to come for a checkup every year. They need to do their egg freezing so that they are more empowered. They need to not get pressurized by having a kid. They are. I see many of these patients of mine or women. I would not call them patient, who come to me and say, "Hey, doctor, I have not got the right person. I don't want to get married. I don't want to compromise. But I would like to have the feeling that I have the right to postpone my fertility." So many, I was just telling today only, at least 4, 5 people are coming to me every month now. When I started doing egg freezing in 2007, I never used to push it. I was a bit, I didn't want to push the technique, but now they are totally empowered. I don't
Yeah.
have to say anything. They are phoning and saying, "Doctor, I want to come for egg freezing." Well, today, just in the morning, I've seen 2 patients who have come for egg freezing. So,
Yeah.
yeah, so
But
things are
a
changing
related
drastically.
and a related thing, again, so there's the spectrum of menstruation, which is like early years of women all the way to, I guess, midlife at some point. But now we're finally talking perimenopause. We're talking about menopause. For my own mother, these are taboo conversations. Perhaps even 2 degrees away from where I live, this could still be taboo. In as you've been saying, education is not often linked with choices of healthcare. So, as somebody who has, I mean, we were together last at the panel on menopause. What do you think is changing about us accepting this? Do we have more agency over our bodies, or are we willing to have more agency over our bodies? Perimenopause, menopause in specific.
I think these are really challenging issues because a lot of women, as you rightly said, may not know also that there is something called menopause or something called a menopause syndrome. Not only among the not so well off, but also in the well off section. So I think that we need to really ramp up our awareness campaigns to a next level. And I think one of the ways to do it is through the mobile phone. So I personally, messaging is very important, and that's going to make a difference. So, and you going to the community is very important because a lot of them are in the community. I personally feel, I did one just now when I became president of FOGSI. I did a yatra where I started from Hrishikesh and I traveled 4,000 kilometers. This was supported by PNG, and we traveled 5 states and covered nearly 6 million people of the country, and we did a lot of health camps, and I found that this is there's a lot of lack of knowledge about everything. I was really, well, we have a long way to go, and it's a challenge, but I look at the maternal mortality. We have come to 97 per 100,000 from 400 per 100,000. India is one of the, in Pakistan and all, the maternal mortality is 200 plus 300 in that region. So and in some of our states like Kerala, it is 20, and in Maharashtra, it is 30. So some of the states have really gone, and United States is around 23. So we are really touching. So because the government, I feel government has been very proactive, and government,
Correct.
I feel that this government, and I'm also saying the past government, they are really respected women. No end. All the
Yeah. We
legislators
just need now
are
more
pro
focus
women.
on women's health and health
Yeah,
beyond just motherhood. I think that
right.
is really the crux of the issue. I appreciate your time and thank you so much. And I expect you and us will be together in this journey to help
Yeah.
increase advocacy, awareness, and normalize the idea of women claiming their health rights. Thank you so much, Dr. Pai.
Thank you. Thank you.
Thank you.